Hello, it's 11 a.m. here in Seoul. I'm Usuyoung at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak here in the country. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation available for you in English. Health Ministry official Yoon Tae-oh will be giving us details on the COVID-19 situation here in Korea. He's going to fill us in on the number of new infection cases as of midnight, as well as the efforts that the government is making to contain the virus. Although the sudden spike of the virus has subsided in recent days, back down to the 400 level, of course, health officials are still making various efforts to actually contain the virus in the country and overcome what we're seeing right now, a third wave in Korea. And we are now cutting into the briefing room, and Yoon Tae-oh will be briefing us very shortly.
Let us now begin our regular briefing for January 20th, Wednesday. As of today midnight, we have a total of 373 new local infections and 31 new imported cases. And yet yesterday at the makeshift testing centers, we have identified 72 cases, and we had 17 additional fatalities. And I extend my deepest condolences to the deceased and the members of the bereaved families. Today marks the 1 year, exactly 1 year has passed since South Korea reported its first case of COVID-19 case. And during the past week, the government united with the public to overcome our battle against the COVID-19. And looking back in our experience, we had 3 crises. And the first wave was during the February and March, the large-scale outbreak in Daegu and Gyeongbuk area. And second was the one in the second wave in the August, and the third wave that we are experiencing right now. We have carried out massive testing, and we have traced the patients, and we have isolated them swiftly, and we provided necessary treatment as well. These were the major responses that the South Korean government took. And in this process, we also put in place a drive-through screening center, and also we have developed an electronic visitor log, as well as live treatment centers to treat light symptom patients. And we carried out successfully some very innovative ways of fighting the COVID-19. And we also sought many ways to overcome the virus, to contain the virus. And we have exerted our full efforts to contain the virus here in the country. And as a result, among the members of the OECD countries, out of every 100,000 people, we have had the third lowest number of confirmed cases. And together with this, out of the member states of the OECD countries, we top the list in terms of economic aspects, development as well. And these were also achievable thanks to the public's efforts and participation. They also took part in these quarantine measures, and we were able to contain the virus to a large extent without any extensive lockdowns as seen in other countries. And we were able to provide very transparent information. And we believe that transparency, openness, and democracy in fighting over the COVID-19 is something that we can boast about in together with the cooperation exerted by the members of the public. All of this was possible thanks to all of the people's dedication as well as contributions. Even at this moment, there are many medical professionals as well as quarantine officials who are working on the field. Moreover, there are frontline workers, especially the medical professionals at the public hospitals and military hospitals, and their efforts shall all be remembered by the rest of the public. And also, people were fighting against the scorching heat as well as cold weather at the screening centers. And also there were also many people who were testing these patients and analyzing the results of the testing at all circles with spending sleepless nights. And also, in order to curb the influx of imported cases during the past 1 year, there were also many people who were working under the emergency shift. And there are also many investigators as well as epidemiological workers who are also exerting their full efforts. We thank them once again. Moreover, there are also the members of the military, the police, as well as firefighters who have been also exerting their full efforts at each of their fields. We believe that this pandemic, this unprecedented pandemic, has also enabled many people, especially many sacrifice from the public services, and their sacrifice helped us to overcome the virus. We thank you once again. All of these people who are working at the government ministries, we also exert our gratitude to your cooperation and help as well. Aside from these people that I have mentioned, there are many more others on the list who have exerted their full efforts in all corners of life, especially at the front lines as well. We thank you once again. Moreover, based on the trust of the public, there are also many members of the media who have been acting as a bridge between the government and the public to provide and disclose transparent information. And above all, my thanks also goes to the rest of the citizens and people of the public who have exerted their full effort as well. There are also many people, especially the self-employed and micro business owners, to whom I should also apologize at the same time. We were able to have a successful response against the COVID-19 thanks to the participation and cooperation by the public. And thanks to your public effort, we were able to overcome our crises. And once again, we were very astonished by the high level of civil awareness that our people exerted so far. Thanks to your efforts, we were able to overcome the three major waves, and we were able to contain the scope of these waves. And I thank you once again wholeheartedly. During the past year, we have walked a very long channel, and we are also providing a video record of the past year on our website of the Ministry of Health and Welfare. And up until the past week, we have about 450 domestic local infections on a daily basis, and we are seeing a downturn in the number of new cases. We have seen a downturn, however, there are continued local transmissions, especially between people. Therefore, I ask the people to refrain from having meetings and gatherings. And also in the metropolitan area, starting from November until the first week of January, there has been an on-week decline of foot movement. However, we are seeing a rebound in these foot traffic for the metropolitan area. Especially during the past weekend, we had an 13% on-week rise as well, and we need to also exert full efforts in order to comply with the social distancing measures, as they have been eased only partially, as we need to consider the difficulties and challenges imposed and faced by the self-employed as well as micro business owners. Above all, it is very important for us to minimize physical contact at this moment, so you need to cancel all of your physical gatherings, social gatherings, and travel plans. And please remember that we have a gathering ban on 5 or more people. As for the quarantine measures, we have carried about a total of 71,000 cases so far on a daily basis yesterday, and nationwide we carried out about 51,000 cases, and also at the makeshift testing centers around the country, we carried out 25,000 cases. So it is very important that you get tested as soon as possible if you have any suspected symptoms. And here are some updates on our medical capacity. And we are seeing 0 patients who are waiting for to get to the hospital for over a day. And we also have a very sufficient number of hospital beds nationwide. And as for the critically ill hospital beds, we have about 320 hospital beds available nationwide. And also in the metropolitan area, we can also utilize 118 beds likewise as well. And we also have many hospital beds, about 150,000 15,000 beds available for light symptom patients. And we have also mobilized 240 new doctors and also thousands of nurses, and a total of 240,000 have been also mobilized to the scene to help with these medical responses. And as for those who have been discharged, here are some updates. Those who have been discharged after full treatment, they do not have the virus, and they will not transmit the virus, and they are also allowed to have outpatient services at major hospitals. However, there are many cases where hospitals are opposing to the hospitalization of people who have been already discharged from COVID-19 treatment. And we would also like to say that we will provide more incentives for the hospitals by over 10-fold of incentives for these hospitals who hospitalize these patients who have been fully treated. So we ask for your cooperation, especially for the nursing hospitals. Currently, we are still going through our third wave of the COVID-19 outbreak here in the country. We still have a daily number of 400 cases on a daily basis. And if we are able to overcome and sustain the current downturn, we believe that we can overcome the third wave as well. Of course, the past year was very challenging for all of us. However, at the same time, we were able to muster all of our strength to fight against the COVID-19 virus. The government has great hope and great trust in the level of the public and the energy of the public to overcome the virus. And going forward, we believe and we will exert our full efforts to overcome COVID-19. Thank you very much.
That was a government briefing you heard on the COVID-19 situation here in the country. Health official Yoon Tae-ho told us that there were 404 new cases reported on Wednesday as of midnight, bringing the accumulated number of cases to 73,518. There were unfortunately 17 more deaths. That raised the death toll to 1,300 as of Wednesday. We're going to wrap up the coverage here, but we will be back at 12 p.m. Korea time with our midday news with Mark Broom. Bye for now.